Hi guys, welcome to my YouTube channel. I am Aranas, a postgraduate medical intern. I basically provide informative videos to medical students. And also, I would like to give aspiring Filipino physicians an idea of what a medical student usually tackles in med school. If you find these videos helpful, please don't forget to hit the like button and subscribe and click the notification bell to be updated for my new videos that I'll be uploading every week. Okay? For today, I'll be discussing the clinicopathologic correlation of heart failure. Heart failure is sometimes known as congestive heart failure. Okay, this is a chronic condition that affects the pumping power of the heart muscles. Uh, the heart cannot keep up with its workload, and the body may not get the oxygen that it needs. It does not mean that the heart has stopped working. Rather, it means that the heart works less efficiently than normal. So this is a very important disease that we have to talk about. I would like to shout out to my girl, Danica Fernandez, for helping me out in creating this clinical pathologic correlation. And we'll be discussing this per section. So let's start. Here are the risk factors that we have to consider when we're talking about heart failure. First is the advanced age of the patient, the history of heart disease, and obesity. And most importantly, among it all, is the chronic hypertension in the patient. Okay, because chronic hypertension would lead to pressure overload and sustained increase in mechanical work. That would then increase the wall stress and cell stretch. So the heart would now compensate. What would it do? It would hypertrophy and or dilate. These compensatory mechanisms of the heart would lead to a decrease in the supply of oxygen. And the decrease in the supply of oxygen would stimulate three responses. This include activation of the renin-angiotensin-aldosterone system, and the activation of adrenergic nervous system, and the activation of vasodilatory molecules. All of this should be combined in effect to increase cardiac output via increasing the salt and water retention and could be manifested by our patient as leg edema. This fluid retention would lead to increase in left ventricular filling pressures and increase in cardiac output and afterload. Now, the excess water retention would be the important explanation of the symptoms of heart failure. And it could manifest as weight gain because of the excessive fluid retention. And then this would now cause an increase in left ventricular end diastolic volume and pressure. It would lead to two effects, increase in left ventricular preload and increase in the afterload, angiotensin 2 and catecholamines. So we'll be discussing this one at a time. So as for the increase in left ventricular preload, this is manifested in the patient as positive hepatojugular reflex. And then that would lead to increased pressure in the pulmonary vasculature as manifested by accentuated P2 sound. P2 sound is the sound produced upon closure of the pulmonic valve. Okay, so there is a louder closure of pulmonic valve. Okay, next is the increase in pulmonary capillary wedge pressure. This would now explain the manifestations as dyspnea, crackles, nocturnal cough, and orthopnea, as the lungs are drowned in fluid, okay? So these are all manifestations brought about by excess fluid retention in the lungs, okay? And then as for the other effect, the increase in the afterload, angiotensin 2 and catecholamines, this would now cause the left ventricular remodeling. And there would be cellular changes. These include alterations in the myocyte biology, myocardial changes, alterations in left ventricular chamber geometry. And this would now lead to left ventricular dilation, increase in wall thinning, and there would be eventually an afterload mismatch. And the further decrease in stroke volume would lead to decreased cardiac output. And this would be experienced by the patient as easy fatigability. Okay, so those are the explanation of the manifested symptoms of the patient. So here is the reference for this discussion, the 20th edition, Harrison's Principles of Internal Medicine. I would like to end this presentation by telling you how my patient inspired me with his life story of courage against all odds. He told me that the challenges he surpassed in his life and how he made it through with faith. Okay, he gave me a remembrance, a rosary from Jerusalem. He always told me not to forget God in my life and always ask for strength. We have to let go and let God, and through Christ, all things are possible. And we should always put all our trust to the Lord our God. Thank you for listening and have a good day.